This is the first of a video series that I'm making about all the different ways that people in their retirement years face challenges with regards to their oral health. Because there's a lot of hard things that you all face. And I just figured, I don't know if anybody's talking about it, so I'm going to do it. I'm Dr. Laura Fauchier, and I am a general dentist who treats adults in Marion, Iowa. So what I'm going to do is I'm going to talk about a list of some of these challenges. What are they, you ask? Well, I'm about to tell you. The first is that, believe it or not, as we age, we get more susceptible to cavities. We get cavities when we're young, like age 4 to 20, and then a lot of us reach a place where we don't get very many cavities. And then once we get over 60 or 70, we start getting more cavities again. I'm going to talk about that. I'm going to talk about the progression of gum disease and why it's important for your oral health, but also your overall health. I'm going to talk about heart health issues and how that's connected to your mouth. I'm going to talk about surgery, implants, pain. Did you know that patients over 65 experience more pain? We're going to talk about previous trauma with dental experiences. We're going to talk about Medicare dental insurance because that's become a thing for my patients. We'll talk about old mercury amalgam fillings and cracks and also failing root canals. So those are the topics we're going to be discussing. If you didn't hear something that you want me to talk about, leave a message in the comments. I'll see if I can make you a video about that. All right. We'll see you soon. I want to talk to you about cavities. Did you know that once we reach our retirement years, over 65, we have a tendency to get more cavities? And there's two main reasons for this. The first is that many of us do not have as much saliva as we used to. So it could be because of medications, autoimmune conditions. We could have had disease to our salivary glands, or we had radiation when we had cancer, and the result is that our mouths are dry. Well, we need that saliva. It protects us. And so that puts us at a higher risk. And it's a good idea to have a conversation with your dentist about how to protect your teeth from having a dry mouth. The second reason that we get more cavities in our older age is that we get recession around our gums, meaning the gums have pulled away from the tooth, and the root of a tooth is skinnier than the top of a tooth. And so there's more negative spaces, more emptiness where food and things can get kind of trapped in there. And it's harder to clean that when you're just brushing to get the chewing surfaces of your teeth clean. That's one thing. But when you're in there, what I call all the nooks and crannies, it can be a lot more hard to keep that clean. It takes more time and more diligence. And that's during a time when, as we age, our dexterity is actually going down. So that makes it a challenge as well. So we were just talking about why we get more cavities as we age, which seems so unfair, doesn't it? But I want to talk for a few minutes about strategies that we can use in order to avoid that pitfall and all the expense and pain that comes with it. So we were talking about having a dry mouth and more nooks and crannies, or areas where plaque and food can accumulate as we age. And so one of the first things that I want to point out is that we have to be extra diligent about getting everything super duper clean, getting that bacteria off of our teeth after every meal. And I highly recommend a water pick on full blast once your gums can tolerate it, and getting in around all those little nooks and crannies. Just get it all cleaned out, because then the bacteria can't eat the food and make the acid that causes your cavities. The next one is to talk to your dentist about different special medications that you can use, rinses and toothpaste, and that'll be between you and your dentist which ones you choose, but ones that are extra protective, not just your average toothpaste and mouthwash from the drugstore, but the ones that your dentist recommend for you. The next one has to do with your diet, because you know what happens as we age is it's harder to swallow, and our daily living is simplifying, and we have a tendency to eat foods that have become more processed over time. And that's really good for the bacteria that like to make cavities in your mouth. So finding foods that are closer to how nature made them protects your teeth, and then also making sure it's a variety of hardness. So you want to eat some crunchy stuff, like vegetables and nuts and things like that, because the soft breads and soft crackers and stuff, they'll go right up into there in those nooks and crannies and stay until you have a cavity. I want to tell you about one more thing, a reason why we get cavities as we age. And it's another one of those things where nature has just done a dirty by us as we age. Like, this is totally unfair, but it happens and it's real. So around our tooth, the chewing part of our tooth, we have enamel. Enamel is like a hard candy shell that protects your tooth from cavities. It's kind of like the bark of a tree in that it wraps you in this nice, safe cocoon. Inside the enamel is another substance called dentin, and dentin is soft. It's a little bit more cushiony, so that when you're chewing, you're not shattering your teeth all the time. Most of your tooth is dentin. Just the part that sticks out of your gums is enamel. But, you know, as we age, we get this recession thing where the gums start to pull away from the tooth, right? And that exposes an unprotected part of the tooth, which is the root. The root has some cementum and dentin, which, like I said, is kind of like having wood that's unprotected from the bark. And this area gets cavities a lot more easily. And not only that, but the trip from the outside of a tooth on its root to the nerve of the tooth is a much shorter distance. And so not only can we need more fillings when we age, but we can also end up getting infected teeth, or teeth that we can't even save at all. So protecting ourselves from those root cavities means those things that I said in the previous video, keeping those roots impeccably clean and staying away from those processed carbohydrates, bread and cookies and things like that. So today I want to talk to you about gum disease and the progression of gum disease. You know, the ADA has estimated that around half of adults have gum disease. And, you know, when you're 30 years old, most people haven't really experienced the full effects of gum disease, because what happens as the gums are pulling away from the tooth in a pathological way is that it takes a really, really long time, like a decade, to lose 2-3 millimeters of support. But over time, you know, this is one of those diseases that takes a long time, and so we think it's a disease of old age, but it's something that's been accumulating for a long time for people. And what happens is sometimes when they're 60, 70, 80, 90 years old, they begin to lose teeth because the gums have had enough time now to really pull away from the tooth, and then it eventually gets loose. By the time a tooth is loose, it's pretty much too late to save it. There are a few teeth that I've been able to save in my practice, especially the lower front ones, where we can kind of splint them and treat the area with a laser. But for the most part, if a tooth is already loose, it's gonna go bye-bye, unfortunately. So for my aging patients, I really recommend that we get in there and clean the tartar off of their teeth on a very regular basis, at least 2 times a year. Some of my patients come 4 times a year if they're at a high risk for getting bleeding gums and unfortunately for losing the bone that helps hold those teeth in place. I'm going to keep on talking about gum disease in the next video, so we'll see you there soon.